The Vancouver Clinic ophthalmology team has prepared this 14-minute video for patients who have been referred for a cataract evaluation or who have symptoms that suggest that they may have a cataract. It answers the most commonly asked questions about how cataracts develop, how modern-day cataract surgery is performed, and what factors to consider when selecting an intraocular lens or IOL to best meet your vision needs. A detailed transcript can be found in your preoperative surgery packet. Human eyes have an external cornea and an internal lens that work together to focus light on the light-sensitive retina at the back of your eye. The journey of light begins with the cornea. This is the clear, dome-shaped surface on the outside of the eye. The cornea starts the process of focusing light by bending or refracting light as it enters your eye. The cornea provides roughly 2/3 of the eye's optical power, but unlike the lens, its focal point is fixed. The remaining third of the eye's focusing power comes from the natural crystalline lens, which sits immediately behind the iris. Unlike the cornea, the lens changes its shape to adjust the eye's focus, a process known as accommodation. In adulthood, the lens gradually stiffens and the amplitude of accommodation gradually decreases year after year. Although this change takes place throughout your 20s and 30s, it doesn't usually become clinically relevant until your 40s, when it reaches a point that it interferes with everyday tasks. This normal process is called presbyopia. After age 40, even patients who have never needed glasses begin to struggle with activities like reading, writing, sewing, applying makeup, or shaving. This aging of the natural lens is universal and follows a predictable decline between age 40 and 60. Around age 60, the natural lens has lost virtually all its flexibility, and the entire eye becomes an optical system with only a single focal point. With time, the inactive lens becomes yellow and cloudy. At this stage, it is referred to as a cataract. Cataracts are primarily related to aging, but can be accelerated by trauma, diabetes, UV exposure, smoking, and steroid medications. In the early stages of a cataract, most patients struggle with nighttime driving and/or driving in the rain. Many patients develop glare, halos, and/or starbursting around lights. Patients often find themselves depending on more light to be able to see smaller details, but also more sensitive to bright lights. Colors gradually appear less vibrant, faded, or dull. As a cataract progresses, vision becomes more blurry in all lighting environments. Frequent changes in glasses or contact lens prescriptions are common. The vision becomes more blurry and hazy. Some patients frequently clean their glasses because they perceive that they are looking through a dirty window. Fortunately, cataract surgery can be done to restore clarity to patients suffering from cataracts. Cataract surgery has evolved tremendously over the years and includes the use of highly advanced technology to help restore vision. Cataract surgery is the most common surgical procedure performed worldwide and is among the safest of procedures. In the U.S., roughly 4 million cataract surgeries are performed each year. According to the American Society of Cataract and Refractive Surgery, up to 98% of cataract surgeries result in improved vision, assuming that there are no other conditions affecting sight. Less than 1% of patients perceive their vision as being worse after surgery. However, surgery is still surgery, and complications, while rare, can occur. Potential complications include infection, bleeding, inflammation, and retinal detachment. Most of these conditions are treatable, but there is a small risk of permanent vision loss. Here at Vancouver Clinic, the rate of surgical complications is much lower than what is reported in the literature. The likelihood that you'll have a complication that requires a second trip to the operating room is only 3 out of 1,000. Surgery is the only way to remove a cataract. No medication can reverse a cataract. If you do not have surgery, your vision will continue to gradually worsen over time. As long as you meet the criteria for surgery, you are free to decide at what stage of vision impairment you would like to proceed. Your doctor will let you know if you meet the surgical criteria and whether or not updating your glasses could offer a non-surgical approach to improving your vision. Although cataracts will progress without treatment, the surgical risks increase only slightly as you age. Because surgery is so safe, most patients opt to proceed long before going blind from a cataract. Cataract surgery is almost never an emergency, and the timing should work conveniently with your schedule. Two situations where your surgeon may insist that you proceed are 1. If your vision is impaired enough that you are putting other people at risk on the road by driving, or 2. If your untreated eye is at risk of a potentially blinding condition called acute angle closure glaucoma. This is a less common indication for surgery, and your doctor will inform you if this is a specific risk to your eye. People often ask how cataract surgery is performed. 2 small incisions are made into the edge of your cornea. A tiny handheld device is inserted and utilizes ultrasound waves to break the cloudy lens into smaller pieces. These fragments are gently vacuumed outside of the eye through a 2 mm incision. The transparent capsule behind the lens is left in place to act as a bag in which an intraocular lens, or IOL, is placed. It's fairly common for the leftover capsule to become cloudy long after surgery. This is referred to as a secondary cataract because many patients experience similar symptoms to when their cataract first occurred. Approximately 1 in 4 patients will have this occur within 5 years of surgery. Fortunately, this can be safely addressed with a totally painless and incredibly safe 2-minute laser procedure that is done in clinic rather than back to the operating room. The entire cataract surgery is typically completed within 10 to 15 minutes. Some surgeries may take longer, such as in very dense cataracts or pupils that do not dilate well. At Vancouver Clinic, cataract surgery is completed without any painful injections behind the eye, and far greater than 99% of cases are done without sutures. A very important part of your cataract surgery decision-making process is selecting an appropriate IOL with your surgeon beforehand. This lens will be a permanent part of your eye after surgery, so you want to be sure that you select the best lens for your visual needs. Your surgeon will discuss with you how you want to use your eyes and where you would like the focal point of your eyes to be set up with surgery. Distance vision is what you use when you're focusing on something that's more than a few feet away. Most patients select to aim for distance vision with cataract surgery. This helps you see birds and trees, street signs while driving, a chalkboard in a classroom, and a movie in a theater. If you opt for distance vision, you should plan on needing reading glasses for near visual tasks. Intermediate range vision allows you to focus clearly on objects that are roughly at arm's length. This is the type of vision that we use when working at a computer, playing a card game, painting, cooking, seeing the dashboard while driving, or working in the garden or shop. Near vision refers to the ability to see objects clearly that are close to the eye. This is where most people focus when they want to read a book, use a mobile phone, sew, apply makeup, or do any other close-up tasks that require attention to fine detail. Insurance plans help cover the cost of only a basic monofocal IOL. These lenses have a single focal point and do not correct astigmatism. Astigmatism most commonly arises from the cornea being shaped like a football rather than being perfectly round. Most patients have a measurable degree of astigmatism. If the astigmatism is large enough and you choose the basic IOL package, you should plan on full-time glasses for all ranges of vision after surgery. Fortunately, an advanced technology lens can be arranged to neutralize the effects of astigmatism. These lens implants are called toric IOLs. The out-of-pocket cost for these customized IOLs is $1,500 per eye. With this advanced technology IOL, you are likely to achieve glasses independence for your desired focal target, but you will likely still need glasses for the targets that you do not select. One way to minimize dependence on glasses and improve range of vision is to do what is called monovision. With monovision, one eye is set to focus on distance while the other is set to focus up close. This does impact depth perception, and not every brain can adapt to this. As a result, this is typically only offered to patients who have successfully done this with contact lenses before surgery. Let your doctor know if you'd like to pursue monovision. A final premium option to consider is a multifocal IOL or extended depth of focus IOL. These lenses are the most expensive of IOLs and cost $3,000 per eye. These implants have a series of concentric rings that work to focus light in a fundamentally different way than your eye has ever experienced. As such, there is no way to simulate the effect this will have on your vision until it is surgically implanted into your eye. The way that they work is by splitting light to provide different focal points. As a result, they work best in situations where there is plenty of ambient light. The major downside to these lenses is how they perform in lower light situations like reading a menu in a restaurant or driving at night. Many patients with these lenses experience halos or glare around lights at night. It may take weeks to months for your brain to adapt to this new way of focusing. A small percentage of patients are unable to adapt to their new vision and request to have this IOL exchanged from their eye. Complications during an IOL exchange are much higher than cataract surgery with primary IOL implantation. Multifocals may not be suitable for patients with macular degeneration, glaucoma, or irregular corneas. It's also important to note that many patients with multifocal IOLs still end up getting prescription glasses after surgery. Unlike multifocal IOLs, toric IOLs do not have major drawbacks, have no neuroadaptation period, are not associated with halos or poor night vision, and can be safely placed in patients with macular degeneration or glaucoma. None of our eye surgeons would hesitate to have a toric IOL implanted in their own eye if they had enough astigmatism to justify their use. In clinic, measurements are taken to calculate the power of IOL that is most likely to help you achieve your goals. We ask some patients to come back to clinic for a second set of measurements on another day. IOL powers are selected in half diopter increments. Even with our most sophisticated formulas, the accuracy within a half diopter is roughly 85%. This is much higher than it was in years past, but it is still not 100%. In patients with a history of previous refractive surgery, these calculations are less accurate. It is crucial that your surgeon is aware of any prior refractive surgery so we can adjust our calculations as necessary. Because of these limitations, there's always a possibility that you'll need a light pair of glasses to fine-tune your desired target, regardless of who does your surgery. Even patients who end up with perfect distance vision may also opt for full-time bifocals after surgery to avoid constantly taking readers on and off. We always provide an updated prescription for patients as part of the standard 1-month postoperative visit. If both eyes are ready for surgery, we usually schedule them a couple weeks apart. This way, we can compare the outcome of the first eye to what we predicted. This can lead to improved outcomes. If you are only frustrated with the vision in one eye, however, your surgeon will discuss how proceeding with one eye might impact your balance and depth perception after surgery. Some patients can go several years between surgeries, while others need both eyes to be done in a short time frame. Surgery is performed at our Ambulatory Surgery Center, or ASC, on the 3rd floor of the Salmon Creek 2 office building. The telephone number to our surgery scheduling team is listed in your surgery packet. They will schedule your appointments and tell you more about what to expect before, during, and after your surgery. Even though it's normal to feel nervous leading up to the surgery, the IV sedation will make you comfortably relaxed during the actual surgery. Most patients are pleasantly unaware that their surgeon is working on their eye. You should not have any pain during the surgery itself. The conscious sedation has a rapid onset and is similar to what most patients receive during a colonoscopy. An eye shield will be placed immediately after the surgery. From check-in to check-out, most patients spend 2 to 3 hours at the surgery center. We will provide you with a checklist to keep track of your post-operative eye drops. Your surgeon will ask you where to send these drops. For 1 week after surgery, we ask that you avoid rubbing your eye, swimming, hot tubs, heavy lifting, eye makeup, or dusty or dirty environments. After 1 week, these restrictions are typically all lifted. You may feel that your vision is good enough to drive yourself to your first post-operative visit, but we ask you to bring a driver until your doctor certifies that your vision is safe enough to drive. Over-the-counter pain relievers and artificial tears are typically sufficient to manage any post-operative discomfort. During the month or so after surgery, it's normal for your cornea to dry out more quickly than your baseline, which gives a similar sensation as to when you have an eyelash in your eye. Most patients begin to notice significant improvements to the vibrancy of colors and clarity of vision within a few days of cataract surgery. It is extremely rewarding to hear patients describe this rapid transformation to how they interact with and perceive the world. Cataract surgery is considered one of the most successful and life-enhancing procedures. We hope the information here provided is insightful and empowers you to make the best decision for your visual needs.